Hello, and welcome back to our channel, where we bring you the most informative and interesting topics. Today's topic is something that we all have been affected by in one way or another, the most dangerous plagues in the world. In this video, we will take a look at 7 of the most dangerous plagues in the world, their history, causes, and the impact they have had on humanity. So, sit back, relax, and let's get started. 7. Yellow fever. Yellow fever is a viral disease that is primarily transmitted by the Aedes aegypti mosquito, which is also a vector for dengue and Zika viruses. Yellow fever occurs in tropical and subtropical regions of Africa and South America, and can cause severe illness, including jaundice, liver and kidney failure, and death. According to the World Health Organization, there are an estimated 200,000 cases of yellow fever each year, resulting in 30,000 deaths globally. The majority of these cases occur in Africa, where yellow fever is endemic. In terms of history, yellow fever has been known to exist for centuries, with outbreaks recorded as far back as the 17th century. However, it wasn't until the 19th century that the disease became a major public health concern, particularly in urban areas. In the late 1800s, outbreaks of yellow fever in the United States led to the creation of the first national public health agency, the Marine Hospital Service, which later became the U.S. Public Health Service. This agency played a key role in controlling outbreaks of yellow fever and other infectious diseases. Yellow fever also played a major role in the history of the Panama Canal, with thousands of workers dying from the disease during its construction. The development of a vaccine in the early 20th century helped to control the spread of yellow fever and allowed for the successful completion of the canal. Today, the yellow fever vaccine is highly effective and recommended for travelers to areas where the disease is endemic. Mosquito control measures, such as the use of insecticides and mosquito nets, are also important for preventing the spread of the disease. Despite these efforts, yellow fever outbreaks continue to occur, highlighting the ongoing need for public health measures and research into the disease. Next up we have HIV, AIDS. HIV, human immunodeficiency virus, is a virus that attacks the immune system, and AIDS, acquired immunodeficiency syndrome, is the late stage of HIV infection. HIV is primarily spread through unprotected sex, sharing needles, and from mother to child during pregnancy, childbirth, or breastfeeding. As of 2021, approximately 38 million people worldwide are living with HIV/AIDS, with an estimated 1.5 million new infections and 680,000 deaths each year. HIV/AIDS disproportionately affects marginalized communities, including men who have sex with men, sex workers, and people who inject drugs. The development of antiretroviral therapy, ART, in the 1990s transformed HIV/AIDS from a deadly disease to a manageable chronic condition. However, access to ART remains a major challenge in many parts of the world, particularly in low and middle-income countries. The history of HIV/AIDS dates back to the early 1980s, when the first cases of the disease were reported in the United States among gay men. The disease quickly spread among intravenous drug users and hemophiliacs, and was initially known as gay-related immune deficiency, or GRID. The discovery that HIV was the cause of AIDS in 1983 led to increased research and understanding of the disease, as well as increased stigma and discrimination against people living with HIV/AIDS. The response to the epidemic has included advocacy and activism by affected communities, including people living with HIV/AIDS, which has led to increased funding for research, prevention, and treatment. Today, HIV/AIDS is still a major global health challenge, but significant progress has been made in reducing new infections and improving access to treatment. Ongoing efforts are needed to ensure that everyone living with HIV/AIDS has access to the care and support they need. At number 5 we have cholera. Cholera is a bacterial infection that causes severe diarrhea and dehydration. The disease is spread through contaminated water and food, and can rapidly lead to epidemics in areas with poor sanitation and hygiene. As of 2021, the World Health Organization estimates that there are 1.3 to 4 million cases of cholera annually, with up to 143,000 deaths globally. Cholera is endemic in many parts of the world, particularly in sub-Saharan Africa and South Asia. Cholera outbreaks are most common in emergency situations, such as natural disasters and conflicts, where access to clean water and sanitation is disrupted. Vaccination and the provision of clean water and sanitation are important strategies for preventing and controlling cholera. Cholera has a long and tragic history. The first recorded pandemic of cholera occurred in 1817, in Kolkata, India. The disease rapidly spread around the world, with outbreaks reported in Europe, Asia, and the Americas throughout the 19th century. Cholera played a significant role in the development of modern epidemiology, as physicians and scientists worked to understand the disease and develop effective treatments. In the 1850s, physician John Snow famously traced a cholera outbreak in London to contaminated water from a single well, helping to establish the importance of clean water and sanitation in preventing the disease. Today, cholera remains a significant public health challenge in many parts of the world, particularly in areas with poor sanitation and hygiene. Ongoing efforts are needed to improve access to clean water and sanitation, strengthen healthcare systems, and prevent and control outbreaks of cholera. Number 4 is smallpox. Smallpox is a contagious viral disease that is caused by the variola virus. The disease is spread from person to person through respiratory droplets, and is characterized by a fever and a distinctive rash that forms small, fluid-filled blisters. Smallpox is one of the most deadly infectious diseases in human history, with an estimated 300 to 500 million deaths in the 20th century alone. The disease was officially eradicated in 1980, following a global vaccination campaign led by the World Health Organization. The history of smallpox dates back thousands of years, with evidence of the disease found in mummies from ancient Egypt and in writings from ancient China and India. The disease was introduced to the Americas by European colonizers in the 16th century, and had devastating effects on indigenous populations. In the 18th century, smallpox was responsible for up to 30% of deaths in Europe, and was a significant cause of morbidity and mortality around the world. The development of vaccination against smallpox by Edward Jenner in 1796 revolutionized public health, and led to the eventual eradication of the disease. The global campaign to eradicate smallpox involved mass vaccination programs, surveillance and containment of outbreaks, and international cooperation among governments and health organizations. The last known natural case of smallpox occurred in Somalia in 1977, and the disease was officially declared eradicated in 1980. Today, smallpox is no longer a public health threat, but the legacy of the disease and its eradication remain an important part of the history of public health and disease control. The lessons learned from the eradication of smallpox continue to inform efforts to control other infectious diseases and improve global health. Next is the Spanish flu. The Spanish flu, also known as the 1918 flu pandemic, was a severe influenza pandemic caused by the H1N1 influenza virus. The pandemic lasted from 1918 to 1920 and is estimated to have infected 500 million people worldwide, or about one-third of the world's population at the time. The death toll is estimated to have been between 17 and 50 million people, with some estimates putting the number as high as 100 million. The Spanish flu is widely regarded as one of the deadliest pandemics in human history, with a mortality rate of around 2.5%. The virus was particularly deadly for young adults, with people aged 20 to 40 being disproportionately affected. The origins of the Spanish flu are not fully understood, but the pandemic likely began in the United States and spread to Europe through soldiers returning from World War I. The name, Spanish flu, is a misnomer, as the disease did not originate in Spain but was first widely reported there due to Spain's neutral status during World War I and its lack of censorship of news reports. The Spanish flu had a significant impact on global public health, and led to the development of modern epidemiology and public health infrastructure. The pandemic also had far-reaching social and economic consequences, contributing to a shortage of labor and a decline in global economic activity. Today, influenza continues to be a significant public health challenge, with seasonal flu epidemics occurring annually around the world. Efforts to develop effective vaccines and improve global preparedness for future pandemics are ongoing, and the lessons learned from the Spanish flu continue to inform efforts to prevent and control infectious diseases. 2. The third pandemic of bubonic plague. The third pandemic of bubonic plague began in the late 19th century and lasted until the mid-20th century. The pandemic originated in China's Yunnan province in the 1850s and spread to other parts of China and Southeast Asia before reaching other parts of the world. The third pandemic was caused by the Yersinia pestis bacterium, which is primarily spread through fleas that infest rodents such as rats. The disease is characterized by the sudden onset of fever, chills, weakness, and painful swelling of the lymph nodes. If left untreated, the disease can be fatal. The third pandemic of bubonic plague resulted in an estimated 15 million deaths worldwide, with the majority of cases occurring in China and India. The pandemic also reached other parts of the world, including Africa, Australia, North America, and Europe. The spread of the third pandemic was facilitated by increasing international travel and trade, as well as poor public health infrastructure and sanitation practices in many parts of the world. The pandemic had significant social and economic consequences, particularly in areas where it caused significant mortality and disrupted trade and commerce. Efforts to control the third pandemic of bubonic plague included public health measures such as quarantine, isolation, and the use of insecticides to control flea populations. The development of antibiotics in the mid-20th century also helped to reduce mortality from the disease. And in the number 1 we have the Black Death. The Black Death, also known as the bubonic plague, was a devastating pandemic that swept through Europe and Asia in the 14th century. The pandemic is estimated to have killed between 75 and 200 million people, with some estimates suggesting that it may have wiped out as much as 1/3 of the population of Europe. The Black Death was caused by the Yersinia pestis bacterium, which is primarily spread through fleas that infest rodents such as rats. The disease is characterized by the sudden onset of fever, chills, weakness, and painful swelling of the lymph nodes. If left untreated, the disease can be fatal. The Black Death first emerged in China in the 1330s and spread along trade routes to the Middle East and Europe. The pandemic reached Europe in 1347, where it caused widespread mortality and social and economic upheaval. Efforts to control the Black Death were limited in the 14th century, as the bacterium was not well understood and effective treatments were not available. Public health measures such as quarantine, isolation, and the burning of infected clothing and bedding were employed, but these measures were often ineffective. The Black Death had a profound impact on European society, contributing to the decline of feudalism and the rise of the merchant class. The pandemic also had religious and cultural implications, with some people turning to extreme religious practices in response to the mortality. Today, bubonic plague is still endemic in some parts of the world, particularly in parts of Africa and Asia. Efforts to control the disease include the use of antibiotics, improved sanitation practices, and measures to control rodent populations. The lessons learned from the Black Death continue to inform efforts to prevent and control infectious diseases in the modern world.